I'll give you.
Anyway.
All right, we are back this morning with the General and Housing Committee, and we're still hearing testimony on unpaid leave. And now we have Joanna from VBSR, and if you'd like to introduce yourself, and I believe you know the committee, so we don't need to introduce ourselves since you were here, obviously.
That's right. Hi, my name is Johanna DeGraffenreid. I'm the Public Policy Manager for Vermont Businesses for Social Responsibility, and we're here to testify in favor of paid family and medical leave today. I recognize this is an unpaid family medical leave bill, but we, of course, have been a longstanding supporter of expanding paid family medical leave in Vermont. I want to quickly thank the committee for the opportunity to testify today, and I'm happy to answer any questions either now or after the testimony, whenever it's convenient for each of you. I represent nearly 600 members of Vermont Businesses for Social Responsibility. Our members include small and large businesses ranging across all economic sectors in Vermont. For years, VBSR has supported comprehensive and universal paid family and medical leave for all Vermonters. This bill is a pragmatic step to equitably expanding paid family and medical leave, and we support the passage of this legislation into law, similar to the other bill which I came in and testified on earlier this legislative session. So you'll hear some repeat testimony today. There are several aspects of the bill which I want to make sure to address in my testimony. The first is the importance of expanding paid family and medical leave to be inclusive of LGBTQIA individuals in Vermont. 12 states have expanded their paid family and medical leave programs to better include LGBTQIA employees and their families, including Connecticut, Maine, New York, and Massachusetts, all of our neighbors. These states have expanded paid family medical leave to cover programs for LGBTQIA individuals, even if these couples are not legally married. With 19,000 employees identifying as LGBTQIA in Vermont as of 2020, according to the Williams Institute at UCLA, and I'm happy to provide that citation. The proposed coverage bill is a crucial step towards addressing the need for paid family and medical leave for working Vermonters and their children, family members, and partners. We also have strongly encouraged the inclusion of miscarriage, which is identified in this bill. And I'd be happy to speak more about that. I've testified about that earlier in the legislative session. We also want to specifically talk about safe leave, which we strongly support the inclusion of in Vermont and the expansion of here in Vermont. It's crucial for Vermonters. This is something where, according to the Women's Bureau at the U.S. Department of Labor, as of April 2024, 6 of the 13 state paid family and medical leave laws permit employees to take leave to address the needs of survivors of domestic violence, sexual assault, or stalking. So of the 13 states with paid family medical leave, 6 of them already cover safe leave. We would be catching up here in Vermont. I want to note that Maine is one of these states. So another one of our neighbors includes safe leave in their paid family medical leave. Again, we would not even be leading in our region. We would be following other states' leads on this important issue. Often survivors of stalking and violence need time to seek medical or mental health care, relocating to a safer home, going to court, or finding support services. According to national survey data, 15.9 million US women, approximately 12.7%, and 6.7 million US men, 5.7%, have missed at least one day of work due to intimate partner violence over their lifetimes, which has a significant impact on our businesses. Ensuring that this time is paid, which would ideally be the way in which this moves in the future, is crucial to protecting Vermonters and protecting our businesses. It ensures that these employees can come back to work fully safe, healed, and protected. It means that they can show up as their full selves as employees, and it means that productivity increases with our businesses. I want to leave you all with some information about the benefits to employers and to the economy when employees are covered under a robust paid family and medical leave system. Caregiving is the bedrock of Vermont's economy and significantly impacts Vermont businesses' bottom line. Employees often face the tough choice of leaving their jobs entirely for caregiving duties and medical needs, while employers bear the high financial and cultural costs associated with employee turnover when they do not have the opportunity to provide these kinds of paid and unpaid medical leave benefits. This economic dynamic has a pronounced impact on gender equity, as the majority of those leaving their careers to provide care are women. And in Vermont, there's a notable 6% labor force participation gap between men and women, partially because of the paid family medical leave issue here in Vermont. Expanding our paid family medical leave policy will only aid in addressing the gender gap in our workforce and ultimately expand the number of employees available for hire during our state's workforce shortage, which we know is a serious challenge here. A lack of paid safe leave also harms businesses and the economy because of the reduced productivity and the increased cost of turnover, as I want to hit home again. The National Institute of Health published a 2017 estimating that the American economy loses approximately $137.8 billion in short-term productivity due to gender-based violence and harassment in 2017 alone. Providing for employees and their families as they seek medical and legal resources after instances of violence and stalking promotes job security and Vermont's economy. Additionally, Vermont has an aging population and workers need to be able to care for themselves and aging Vermonters. Right now, more than 1 in 4 Vermont workers are 55 and older, and within the next 20 years, the proportion of Vermont's population age 65 and older is expected to grow by more than a quarter. Family caregivers are already spending on average a quarter of their income on caregiving activities. However, a universal paid leave program would add about 13,000 family caregivers to Vermont's workforce by 2030, a telling figure given Vermont's current workforce shortage. And that applies, of course, inclusively to all of our LGBTQIA employees, business owners, and community members. Vermont Businesses for Social Responsibility, for the reasons I've listed in my testimony, as well as countless ethical and economic arguments in favor of a large, robust, and universal paid family medical leave program, supports the passage of this bill into law. Again, recognizing that this is currently an unpaid bill, we think that this is a crucial first step in this direction. And we hope that the committee will continue to consider these issues and continue to invite us in for testimony to support the expansion of these crucial programs.
Thank you so much, Johanna. Committee, are there any questions for our witness?
You see that businesses don't have the opportunity to provide paid leave?
It's that with a statewide system, there's a much more robust program to provide these kinds of opportunities. And we can ensure that there's better protections universally for employees when there's a statewide system, as we currently have in place.
System funded by?
Well, currently it's funded through our employees and taxpayer systems. And so we know that right now there's a paid family medical leave program that's very small and limited to certain employees. We would love to see it expanded and robust program because we know that the coverage expansion is based on the pool of applicants, similar to healthcare. If we expand the pool of applicants, it levels the funding playing field for all employers, especially for small businesses, to assist in providing this kind of leave for their employees.
Okay.
So we do recognize this is an unpaid bill currently. So
Right.
what this does is it protects employees' opportunities to come back to work after the need for leave, which is crucial for preventing turnover.
Right, this isn't getting into the paid leave portion, but it's basically just ensuring job security after you take the leave, and which we have now. This just is expanding its impact for 2 other additional categories for bereavement and domestic violence safely, as well as updating the language for folks who have different family structures than previously. Basically. So. That's right. But I understand that that could be very blended together, and appreciate your comments about paid leave as well. Are there any additional questions for Johanna before we?
I just want to note as one last comment, especially to be more inclusive of LGBTQIA employees, family members, children of those family members, that this is crucial for leveling the playing field for paid family and medical leave for our employees and our employers. We need to make sure that we're thinking thoughtfully about all of our employees across the state and how they can be protected equally with all other employees. And this would level the playing field in that way and create parity in many ways with our existing law, which is crucial.
I appreciate that very articulate explanation, better than I.
You did a wonderful job.
Thank you. All right. Well, thanks for coming in.
Yeah, thank you all so much. And please don't hesitate to follow up with me individually if you have any other further questions. And I appreciate your time.
Really
today.
appreciate that, and thanks. So, We heard from a couple witnesses and, as far as I can tell, there was the one thing that we flagged for Sophie that we wanted to kind of discuss, and that will be a policy decision, if we continue moving forward. So, but if there are other things in the bill that, pop out at you, please don't hesitate to, speak up on that. I truly want this to be an inclusive committee discussion and process as we move forward with the bill. So appreciate it. So now we don't, it looks like we are, this is it for the agenda. So I guess folks have a little study hall time before lunch and we'll be back. Nope, we might not, we're not coming back after floor.
We are.
He said we are.
Oh, we
We
are.
wanted to come back to do a possible vote on this bill, but given that there will potentially be drafting changes.
Yeah. Okay.
Do
Alright.
you think he said something else?
What's up?
I
You
think,
shook your head, I didn't know.
Yeah, because I was hoping we were gonna do another process where we read through a bill and then voted on it 5 minutes later. Appropriations tear it apart and say, do your work.
Well,
and
there-
all that
yeah, there's no-
nonsense.
I don't believe there's a fiscal note,
I know, I'm just in
but,
general.
Joe, what are some things that you'd like you to see for this bill?
I'd actually just like to read through it and just think of the questions I'd come
Okay,
up with as opposed to the first time I saw it was this morning, I think.
yeah, no, absolutely. Okay, so more time for you to digest it, Elizabeth?
I'd like to have some lived testimony, and have some testimony not from advocates.
Okay, so you'd like folks that have lived experience from, who are working.
I mean, with no disrespect to the advocates, I strongly object to the first witnesses being advocates.
Yeah, I mean, they're not, okay, that wasn't, yep. Okay. Any other suggestions? So that we can move the bill forward? Not?
Just to be clear, this is unpaid leave with continued benefits. So if they,
Protect medical benefits and protect your position, right?
it's unpaid leave, but they're not getting a paycheck.
No,
But if they're on the company's insurance coverage, that continues during up to 12 weeks of the year? Am I,
So
because
he's
it,
not available.
so I'm not a lawyer, I don't have that language, but that's a question for Sophie, if you'd like to
yeah,
highlight it.
that's an expensive proposition for a small business. That's 3 months. of Insurance coverage with the position that's not generating the income.
With FMLA, the federal law, yes, it includes an extension of benefits during that 3 months. This is exactly the same.
We already
as
have that.
FMLA.
Right, FMLA, okay, so.
Yeah.
thought it was 6 months.
Yeah, for new committee members too, like, again, it is,
Yeah, you're right.
that's
180
something that we
days.
already have,
Just 3 months.
in our federal. It's not changing anything, that's what we have
Okay,
already.
yeah, that's okay. But that's
Yeah, we
already-
can't change the federal,
And that's for businesses that have 50 employees.
right?
At the federal
Have you
level.
decided that?
I'm sorry?
50, it's easier to absorb one being gone. Yeah, okay.
Yeah.
With 3, it's not.
Yeah, this wouldn't be for
Mhm.
the small business.
But unless you're in it, unless, it happens to you, really don't understand.
Oh, I've had all
If
this.
you have
Yeah,
an
so
illness, a
it's-
death, or
it's-
something, I mean, someone needs to take the time off.
Yeah,
Absolutely.
Yep,
I don't have a problem with the concept. I'm just trying to get my head around the expenses that the employer continues.
but nothing's
But
changed,
that's-
that's already in existence.
It would
Well,
be strange wouldn't it be strange to be able to take time off to care for a sick loved one, but lose insurance cover?
Yeah, I can see where, so at the federal level, it's 50, at 50 employee, and partly my question's been answered. At 50 employees, which is the threshold for federal, it's easier to absorb the cost of one person being on leave. This is
Page 2.
businesses, it's different threshold even.
Seven.
So,
10 or more, 15.
yeah, okay, so 15 or more individuals, 10 or more individuals. Everybody, and don't get me wrong, if somebody, one of my employees needs time off, I don't bother dealing with this, how many weeks is this and how many weeks is that, and for heaven's sakes, go take care of whatever you gotta take care of. And in some respects, because I'm like a micro employer, that's easy for me to do. If we were sizable enough, I can envision 10 employees and having one gone. In order for a business with 11 individuals to provide 3 months of medical coverage, if this is federal provides that, but here we're saying an employer, is this just this here? How does this language apply to the employer with 11 individuals? Are we still?
Yeah, again, I'm,
50, or are we now?
this is a Sophie question, I believe,
Okay.
but
All right.
it is my understanding that this is what we already have now. So we can't go back and change we could repeal what we have for unpaid leave for,
I mean, at some point, if you have 2 people go out.
but that's already in statute. Well, this is.
It is?
Yeah.
I don't plan on ever having more than 10 employees. in.
Right, so
That
we're
will put-
not-
Then you've got 10 people out of work in the matter.
Right.
It's not.
It's just stating what we
it
already
doesn't
have.
have that big of a profit margin.
But what we already have now is that what's in the bill. It is existent, so we're not changing
So
that.
in Vermont,
Yeah,
an employer with 11 has to provide.
it's my understanding, yes.
Okay.
So, again, if you want to introduce a bill that changes that, that would be a different bill, but this is just in the bill because it's
I just
stating.
want to think twice before I.
Yeah, of
Number
course.
7, because.
Yeah, no, of course, I understand. But yeah, so
Right.
this is just, the reason it's in there is because it's stating what the current situation is.
Okay,
And so this bill is just expanding the impact to also include people who need safe leave or bereavement as well. Yes, Elizabeth.
I don't know the answer to this. That's why I'm asking the question. But is there any sort of statute that covers disaster with regards to those of you who are employers? Is there anything that covers a disaster
Like if
with regards to unpaid leave?
a person was in a flood and they lost their home and they needed to take time to regroup their life type of situation?
Yeah.
That's a great question. Oh, yes,
Speaks directly to that.
okay.
It's not an individual unpaid or paid family medical leave program that's currently covered under the state that provides for that specific type of leave. However, we do have SBA loans and VGAP loans to go directly to businesses to
Yeah.
help provide for their employees to cover paychecks as
Right.
well as their ongoing costs throughout that process. So while it might not cover an individual, hopefully if a business is impacted, they can apply for that as well as FEMA loans for individuals. But
Right,
It's not a
right.
paid family leave program that's specific to disaster as far as I know.
That is what, yeah, I understand that there's ways to pay employees and that's part of a general recovery package. But I just wondered whether an employee is entitled to take time if they've been impacted by a disaster.
If they have a health impact, then possibly, but if they have a
Yeah,
health
right. But
impact.
if their whole house has
Right.
been washed away, yeah.
No,
nothing.
That's
Yes,
the, no,
so-
unfortunately, that's not covered under current paid
Yeah.
family medical leave, as I
To
understand. it.
replace the person.
Because it really specifically covers
Medical.
bereavement and medical.
But this bill is an act relating to expanding employee access to unpaid leave.
That's right.
It's not specifically medical.
I'm worried about.
That's right,
covering-
but it's covered under the same program.
Can we just
FMLA,
keep
yeah.
one conversation going at a time? Okay, thank you so much. Really appreciate it. We will